Mr. President, this is a really interesting debate. Right now, Democrats are advocating to send $26 billion to insurance companies so that you subsidize plans, silver-level plans, which have a $6,000 deductible. I've asked people who've asked me about this, do you have $6,000 in your bank account to spend on health care before the insurance actually kicks in? Not one has yet raised his hand. And I think some of those advocating for this among Democrats just don't realize the financial situation American families are in when we ask them to pay $6,000 before the insurance kicks in. $6,000 beyond the premium that they are paying for the health insurance. And so patients are going to see their doctor, and they can't afford a deductible. When I was practicing, I'd say to my patients, what about this procedure, this test, this medicine? Doctor, I'm in my deductible. I cannot afford that. And so to have a $6,000 deductible is for many the same as having no insurance at all. Now, by the way, it goes without saying, under your traditional medical insurance plan, you don't get eyeglasses, you don't get your teeth cleaned. Why not, instead of sending 100% of the money to the insurance company, of which they take 20% for profit and overhead, instead we send 100% to the patient, and then she can spend it on the services that she knows she needs. And this is kind of, if you will, the Republican plan. And I'm going to tilt it this way so those in the audience can see, because they represent the American people. Under the Democratic plan, they want to send 100% of the money to the insurance company that takes 20% for profit and overhead. And only 80% goes for patient care. But to get that 80%, you've got to ask permission. We, Republicans, want to give the money to the patient so that she can pay for her physician, her dentist, her drugs, her eyeglasses. She gets the money, and she can get the health care that she knows she needs, as opposed to the health care that she gets permission from her insurance company to get. To put it simply, we want power to the patient, not profit to the insurance company. Now, the other side is going to claim, oh, no, wait, no. In some way that the plan we're proposing does not work out financially for the American people. You're not lowering their premiums. You're not helping them with their first dollar cost. Can we put this up, please? So here's a prospective plan from my state. A couple, 55 years old, with a 20 and a 21-year-old on their insurance policy, 500% of federal poverty level. The bronze plan is $2,250 per month. The silver plan is significantly more expensive, $6,000 more expensive a year. It's almost $3,000. Under our plan, everybody up to age 49 gets $1,000 into their health savings account. If it's a family account, it goes into the family account. And those over 49 get $1,500. So this family of four with those ages gets $5,000 into their health savings account. $5,000 that when I go to the doctor and I've got an earache and I need medicine, the health savings account pays for the doctor's visit, and the health savings account pays for the medicine. Contrast that with what Democrats want. They want a plan which is $6,000 more a month, and the net deductible is higher. And Mr. President, you don't have $5,000 to begin paying for your medical bill. You've got no money whatsoever, and that first trip to the doctor, you're paying out of your purse, you're paying out of your pocketbook. This is the plan that works for the American people? Not. Mr. President, when I was a physician, but no, as somebody who had 3 children, this is not the plan that would have worked for my family. Republicans are trying to meet the American people where we know they are, not where some theoretical, oh, that's where they should be. Most Americans don't have $6,000 to pay for health care before they get to the ability of the insurance. So let's do just kind of a side-by-side comparison. Mr. President, here is the difference between the two accounts. Who gets the money? Under their plan, insurance companies. Under our plan, patients and families. What can the money be used for? Well, here it's subsidized premiums. There, which means that the insurance company gets it and takes 20% for deductible and copay. Under our plan, you can use it for your doctor visit, your x-rays, to see your dentist, your glasses, your prescriptions. This is real medical care, not something the insurance company permits you to have. Who makes the decision? Under their plan, the insurance company. Under our plan, power to the patient. We want that patient, we want that mama, we want that wife, because they're the ones who always make the decisions on health care, to be the one that has the power. Contributes to lower cost? Under their plan, no, because it goes to the insurance company that continues to pay those higher rates. To the patient, if you give her this money, you've got $5,000 to spend it wisely, she's going to say, wait a second, the x-ray is $150 here and $500 there. I'm going to where it is cheaper, not more expensive. And I can tell you when that begins to happen, the people who are more expensive begin to lower their price. This is a plan that by sending it to the patient for real care, to the patients with the power, you empower the patient to shop, driving competition, lowering health care cost. And we just heard from Senator Crapo. Under the plan that my Democratic colleagues support, we've seen widespread fraud and unauthorized enrollment. Under our plan, if you got a health savings account, it's pretty easy. I just signed up for a similar type of account on my health care. You got to show who you are. It's not really hard. It took me about 5 minutes. But the banks that manage this money are going to require that you identify that you're a real person. This is an anti-fraud program. Mr. President, what's not to like? The money goes to the patient, not to the insurance company. It's used for real care, gives the patient the power to shop and find a better price, which lowers health care costs, and along the way, we have mechanisms which cut out the fraud. Mr. President, this should be the basis of a bipartisan deal. Next, please. Was that it? So, Mr. President, I've called some of my Democratic colleagues. Let me start over. I've been asked by the press, why wouldn't Democrats want this? I mean, why would they not want 100% of the money going to the patient instead of 100% of it going to the insurance company, and the insurance company takes 20% for profit and for overhead? Why wouldn't Democrats want to give power to the patient so that she can shop for a better deal, instilling competition, which ultimately lowers cost? Why would Democrats not want a system which begins to squeeze out the fraud that Senator Crapo pointed out is so rampant in this program? I just shrugged my shoulders. I'm not sure. As I say in my Spanish language class, dígame. I'm not quite sure I follow. And then I heard Minority Leader Schumer explain. This is all about Hyde. They're afraid that our plan will not allow abortions, and so they are going to continue to send the money to the insurance company, subsidizing premiums, profit for the insurance companies, contributing to health care inflation, and with unchecked fraud, all because of what is called the Hyde Amendment. Now, by the way, what is the Hyde Amendment? For those watching, the federal government, consistent with the will of the American people, has made a decision not to spend federal dollars to pay for abortion. That's what the Hyde Amendment is. And Republicans, for most Republicans, that's an important part of our position. and Democrats have decided that they're willing to forego all these advantages in order to protect insurance companies paying for abortion. Now, Mr. President, let me tell you the ultimate irony in that. When Obamacare passed, President Obama made a deal in which these plans are not supposed to pay for abortion. Section 1303, if I remember correctly, Mr. President, of the Obamacare law said that these dollars are not supposed to pay for abortion. Now, Democrats are defending dollars paying for abortion. Either they're going to acknowledge that insurance companies are ignoring the law, in which case, wait, we're going to enable insurance companies to break a law, or they're attempting to introduce a source of funding for abortion that President Obama himself did not include. Now, if your rationale to send 100% to the insurance companies instead of 100% to the patient, to subsidize premiums instead of paying for real doctor care, to let the insurance company make the decision instead of the patient, to not contribute to lowering costs versus empowering patients to shop for a better deal and by competition lowering health care costs. And by the way, did I point out they can get a lower premium with $5,000 in a health savings account for that family that otherwise could not afford care? Because you're trying to introduce a new right to abortion in a federal insurance policy? Be honest with the American people. Either the original Obamacare law is being ignored, or you're trying to establish a new right. Now, Mr. President, I have said before, we need to find a way that the American people can afford their insurance. Absolutely. We need to find that way. And I've said repeatedly, I don't want a Republican plan. I don't want a Democratic plan. I want an American plan, a plan that works for our fellow Americans so that they can afford the insurance that this Republican absolutely wants them to have. But we've got to do it in a way in which they have real insurance, not a policy with a $6,000 deductible with lots of fraud associated with it, and which does nothing to achieve the goals that we know we need. And I don't see why Republicans merely pointing out that under the Obamacare law, this was not supposed to pay for abortion in the first place, that should be the reason that we cannot protect Americans from these $6,000 deductibles. With that, Mr. President, I yield the floor.